How do you interpret abnormal free T3 and free T4 levels? Imagine your thyroid hormones as the body's metabolic messengers, telling your cells how fast or slow to work. When these levels are off, it can signal different thyroid issues. Free T3 and free T4 are the active forms of these hormones circulating in your blood, not attached to proteins, and they give us a clear picture of thyroid function. Interpreting abnormal levels helps doctors figure out if your thyroid is overactive, underactive, or somewhere in between. Free T4 is mainly produced by your thyroid gland and is converted into free T3 in your body, especially in the liver and kidneys. Free T3 is the more active hormone responsible for most of the thyroid's effects on your metabolism. Normal ranges for free T4 are usually between 0.7 and 1.9 nanograms per deciliter, while free T3 typically falls between 2.0 and 4.4 picograms per milliliter, though these can vary slightly depending on the lab. When free T4 levels are high, it often indicates hyperthyroidism, meaning your thyroid is overactive. Symptoms might include rapid heartbeat, weight loss, feeling hot all the time, and feeling anxious. Causes could be Graves' disease or thyroid nodules. Conversely, low free T4 suggests hypothyroidism, where your thyroid isn't making enough hormone. Symptoms include fatigue, weight gain, feeling cold, and depression. Common causes are autoimmune conditions like Hashimoto's thyroiditis, iodine deficiency, or previous thyroid surgery. Keep in mind that pregnancy or estrogen therapy can influence these levels by increasing thyroid-binding proteins, which affect total T4 but not free T4. Elevated free T3 levels are often seen in hyperthyroidism and can sometimes be the only abnormal hormone when free T4 remains normal, especially in early or mild cases. This helps doctors assess how severe the hyperthyroidism might be. Low free T3 can happen in hypothyroidism but is less sensitive for diagnosis because T3 levels often stay normal until later stages. It can also decrease in non-thyroid illnesses like severe illness or starvation, a condition called euthyroid sick syndrome. Since free T3 can fluctuate and may be less reliable alone, doctors usually look at it alongside TSH and free T for a complete picture. Speaking of TSH, which is secreted by your pituitary gland, it plays a key role in regulating thyroid hormones. When your thyroid is underactive, TSH tends to be high because your body is trying to stimulate the thyroid to produce more hormones. When your thyroid is overactive, TSH is usually low because the body detects excess hormones and reduces its stimulation. Sometimes, only free T3 is high with normal free T4 and low TSH, indicating a condition called T3 toxicosis, which is a form of hyperthyroidism. Interpreting these results isn't just about the numbers. Your symptoms, medical history, and other tests like TSH are all important. For example, a low TSH with high free T4 and free T3 confirms hyperthyroidism. If TSH is high but free T4 and free T3 are low, it suggests hypothyroidism. Sometimes, pituitary disorders can cause low TSH and low thyroid hormones, which requires a different approach. Remember, lab results can be influenced by various factors such as medications, illness, or pregnancy, so always discuss your results with a healthcare professional. In practical terms, if your free T4 and free T3 are high, it usually points to hyperthyroidism, and treatment might involve medications to control hormone levels. If they are low, it suggests hypothyroidism, and your doctor may recommend hormone replacement therapy. Monitoring these levels over time helps ensure your treatment is effective and your thyroid stays balanced. Always keep in mind that each person is unique, and interpretation of these tests should be personalized by your healthcare provider, considering your symptoms and overall health. If you have concerns about your thyroid function, consult a healthcare professional for a comprehensive evaluation and tailored advice.